Hello, Posa Inyong Lahat. Today our topic is very important. We will talk about the thyroid gland. This is a small gland in our neck. It looks like a butterfly. It is small, but its job is very big. The thyroid makes hormones. These hormones control many things in our body. They control our metabolism, our heart rate, and even our body temperature. When the thyroid is healthy, our body works well. But sometimes, problems can happen. One common problem is called a goiter. A goiter is when the thyroid gland becomes bigger than normal. This can cause a lump or swelling in the front of the neck. It is important to know about this. So, what is a goiter? To put it simply, a goiter is the enlargement of your thyroid gland. Imagine the small butterfly in your neck growing bigger. This can happen for many different reasons. It does not always mean you have a serious illness, but it is a sign that something is not right with your thyroid. The gland might be working too hard or not hard enough. Sometimes the whole gland swells up smoothly. Other times little lumps or nodules can form inside the gland, making it feel bumpy. This swelling can sometimes make it hard to swallow or breathe if it becomes very large. That is why we must pay attention to any changes in our neck. One of the most common reasons for getting a goiter worldwide is a lack of iodine in the diet. Iodine is a very important nutrient. Our thyroid gland needs iodine to produce its hormones. If you do not get enough iodine, the thyroid gland tries to work harder to make the hormones your body needs. To do this, it starts to grow bigger and bigger. It is like a factory trying to produce goods with not enough raw materials, so it builds a bigger factory to try and compensate. This is the body's way of trying to fix the problem, but it results in a goiter. This is why using iodized salt is highly encouraged by doctors. There are also other causes of goiter. Sometimes the problem is not a lack of iodine. Conditions like Hashimoto's disease or Graves' disease can cause the thyroid to swell. In these cases, your own immune system attacks your thyroid, causing it to become inflamed and enlarged, or it can cause the thyroid to produce too much hormone. Another cause can be thyroid nodules, which are solid or fluid-filled lumps that form within your thyroid. Most of these nodules are not cancerous, but they can cause the gland to grow. Pregnancy can also sometimes cause a slight enlargement of the thyroid. Knowing these causes helps us understand why a checkup is so important. It is very important to know the signs of a thyroid problem. The most obvious sign of a goiter is a visible swelling at the base of your neck. You might notice it when you are looking in the mirror or when you are buttoning your shirt collar. The swelling can be small or it can become very large. Along with the lump, you might feel a tightness in your throat. It can feel like you are always wearing a tight turtleneck sweater. Some people find it difficult to swallow food, or they might have a hoarse voice. A persistent cough that is not from a cold can also be a symptom. Pay attention to these feelings in your neck area. Aside from the physical lump, there are other symptoms related to the hormones. If your thyroid is not making enough hormones, this is called hypothyroidism. The symptoms can be media group, tired woman or man resting on couch, person checking weight on scale, person bundled up in warm clothes indoors at stock at distribute_equally, feeling tired all the time, gaining weight easily, feeling cold, having dry skin and hair, and even feeling sad or depressed. On the other hand, if your thyroid is making too much hormone, this is called hyperthyroidism. The symptoms for this are the opposite. You might feel media group, anxious adult fidgeting, person checking rapid pulse, person standing on scale with surprised expression, person with shaky hands, person awake in bed at night at stock at distribute_equally, anxious or irritable, have a rapid heartbeat, lose weight without trying, feel shaky, and have trouble sleeping. These symptoms can affect your daily life a lot. Certain factors can increase your risk of developing a goiter. A lack of dietary iodine remains the biggest risk factor, especially in certain parts of the world. Being a woman also increases the risk. Women are more likely to have thyroid disorders than men, especially during pregnancy and after menopause. Age is another factor. The risk of goiter increases as you get older, particularly after the age of 40. Your family history is also very important. If your parents or siblings have a history of goiter or other thyroid diseases, you are more likely to have them too. Knowing your risks can help you be more careful. Another risk factor is exposure to radiation. People who have had radiation treatments to their head or neck area may have a higher risk of developing thyroid problems, including nodules and goiter. Some medications can also interfere with thyroid function. So it is important to tell your doctor about all the medicines you are taking. Understanding these risk factors is not meant to scare you. It is meant to empower you. If you know you have some of these risk factors, you can be more proactive about your health and talk to your doctor about regular screening for your thyroid. Knowledge is the first step to good health. The good news is that we can do many things to help prevent goiter and keep our thyroid healthy. The simplest and most effective step is to ensure you get enough iodine in your diet. The easiest way to do this is by using iodized salt in your cooking. In many countries, salt is fortified with iodine for this exact reason. Just a small amount is enough for your daily needs. When you buy salt at the grocery store, check the label to make sure it says iodized. This is a very small change in your kitchen, but it can make a very big difference for the health of your thyroid gland and your overall well tummy. Aside from iodized salt, you can also eat foods that are naturally rich in iodine. Seafood is an excellent source. Fish like tuna and cod, as well as shrimp and other shellfish, contain good amounts of iodine. Seaweed, like the one used in sushi or soups, is also very high in iodine. Dairy products like milk, yogurt, and cheese are also good sources. Eggs, especially the yolk, contain iodine too. By including a variety of these foods in your weekly meals, you can help your thyroid get the fuel it needs to function properly. Eating a balanced diet is always a good idea for your total health. It is also wise to be mindful of certain foods called goitrogens. These are substances found in some vegetables that can interfere with how your thyroid uses iodine. Goitrogenic foods include raw vegetables from the cruciferous family, such as cabbage, broccoli, cauliflower, and kale. This does not mean you should stop eating these healthy vegetables. The key here is the word raw. Cooking these vegetables usually deactivates the goitrogenic compounds, so you can still enjoy them steamed, boiled, or stir-fried. It is only a concern if you eat very large quantities of these vegetables in their raw state every day. Moderation is key. Managing stress is also beneficial for your thyroid health. Chronic stress can affect your hormones, including your thyroid hormones. When you are always stressed, your body produces a lot of cortisol, the stress hormone. This can interfere with thyroid hormone production and can make existing thyroid conditions worse. Try to find healthy ways to relax and manage stress. This can be through light exercise, like walking, deep breathing exercises, spending time in nature, or enjoying a hobby. Taking care of your mental well-being is an important part of taking care of your physical health, including your thyroid. And even with a healthy diet and lifestyle, it is still very important to have regular checkups with your doctor. This is especially true if you have risk factors for thyroid disease or if you notice any symptoms. A doctor can perform a simple physical exam of your neck to check for any lumps, nodules, or enlargement of your thyroid gland. This is a quick and painless check that can detect a problem early. Do not be shy to tell your doctor about any symptoms you are feeling, even if they seem small, like feeling more tired than usual or changes in your weight. Your doctor is your partner in health. If you are lactose intolerant and cannot drink milk for iodine, do not worry. There are many other excellent sources. As we mentioned, seafood like fish and shrimp are packed with iodine. Eggs are another great and affordable option. Just eating 2 eggs can provide a good portion of your daily iodine needs. Fortified foods are also available, so check the labels on bread or cereals. For those who enjoy plant-based options, certain seaweeds are very rich in iodine, but be careful not to have too much. A balanced approach from different food sources is the best way to ensure you are getting enough of this vital nutrient. If your doctor finds a lump or suspects a thyroid issue, they will likely refer you to a specialist called an endocrinologist. This is a doctor who specializes in hormones and the glands that produce them. The endocrinologist may order further tests to get a clearer picture of what is happening. These tests might include a blood test to check your thyroid hormone levels, TSH, T3, T4, an ultrasound of your neck to see the size and texture of your thyroid, or sometimes a fine needle biopsy to check if a nodule is benign. These tests help to get the right diagnosis and the right treatment plan for you. Please remember, finding a lump in your neck can be scary, but most thyroid nodules and goiters are not cancerous and can be managed effectively. The most important message is to be proactive. Take good care of yourself, eat a healthy diet, and listen to your body. If you feel something is not right, especially in your neck area, please consult a doctor right away. Early detection and treatment lead to the best outcomes. Taking care of your thyroid is taking care of your whole body. Mabuhay po kayong lahat, and stay healthy.